This particular patient here had a autoimmune type of eyebrow alopecia that we had treated successfully for the last 3 years, and just recently the alopecia doesn't seem to be as responsive to the steroid infiltration. So as a consequence, what we decided to do is single follicular unit transplant to the eyebrow area, and you can see the doctor here is in the medial aspect, and we have quite a nice result. John, how many follicles did that require?
130.
Okay, and you harvested from the occipital area in the back of the head? Or?
Yeah, from the donor side.
Absolutely. And will this grow now the same way as
the first?
Normal hair will grow?
Yeah.
Absolutely.
It's exactly the same.
And will it fall out again after a few months and then regrow again?
Actually, it will fall out after some weeks, and then it will start growing.
Okay. And do you find yourself that the hair that grows then is very, very like eyebrow hair?
It would be very, very fine.
Okay.
And it will have a very good symmetry, as you see.
Absolutely. Yeah, the symmetry seems perfect. Well, thank you very much for that indeed.